Hi, in this video I will talk about sensory behaviors, what they are, why children with autism engage in such behaviors, and then I will provide you 4 evidence-based strategies on how to manage a child with ASD sensory behavior. So, what are sensory behaviors? Sensory behaviors are all the behaviors that are done by the child because it makes them feel good and it gives them a sense of comfort and pleasure. Examples of sensory behaviors can be mouthing, spinning in circles, hand flopping, covering ears, rocking, fidgeting, and many more. Children with autism manifest many sensory behaviors that look different from those manifested by a typical child. The sensory behaviors in children with ASD occur because of the sensory processing differences. All sensory behaviors look different and they are a way of coping with the surrounding environment. It is a response to all the environmental stimuli such as sound, colors, light, smell, and texture. Sensory behaviors often serve a purpose for the child, such as reducing anxiety or providing sensory input. These behaviors occur everywhere, in public, at home, or alone in the room. Observing and understanding the triggers and consequences of these behaviors can help you develop appropriate strategies. For example, if covering ears occurs in a response to loud noises, providing noise-canceling headphones may be helpful. Now that you know what sensory behaviors are and why children with autism engage in them, it is time to learn how to manage them. As I mentioned earlier, I will provide 4 evidence-based strategies. First, design an individualized environment. No one knows your child better than you. A parent is the key to most of a child with ASD likes and dislikes. As a parent of a child with ASD, you know best what may trigger your child's behaviors. Based on your knowledge of your child, based on your observations, develop antecedent strategies that can prevent an inappropriate sensory behavior from occurring. For example, if you know that your child likes to run, jump, and bounce off the walls, provide the child with a treadmill and a trampoline. If you know that your child likes the pressure and the physical touch, provide the child with a weighted desk, weighted blanket, or a massage chair. Design the child's environment based on your child's unique needs. Think of the sensory stimulus that an individual on the spectrum likes and provide the child with that sensory need in a positive and socially accepting manner. Second, offer options of alternative sensory experiences. Be open-minded. Try to have a deep understanding of your child's sensory needs. As a BCBA, I learned the theory, and I know that for a sensory behavior, we need to interrupt and redirect to an alternative sensory item that will satisfy a child's sensory need. But from my experience, I learned that one size does not fit all. For example, for every child that is engaging in mouthing behavior that has as function the self-stimulatory aspect, we are prescribing chewies. Therefore, I discovered that not all the chewies may work for a child. Besides replacing the mouthing on objects with a chewy, you need to pay attention to the texture that your child mouths on. If the child likes smooth surfaces, then you will need to offer the child a chewy with a smooth surface. Or if the child mouths on fabrics, then you will give a necklace chewy from fabric. So, every child is unique and needs to be treated individually based on their specific needs and likes. Third, visual schedule. It is important to use a visual schedule. By offering a visual schedule to the child where you incorporate all those sensory needs, you attain control over the sensory behaviors. Through the use of visual schedule, you develop the child's ability to self-advocate for themselves and work on their independent skills. For example, you have in place for your child different structures to satisfy the sensory need for climbing. You have a treadmill to satisfy the need for running. You have a hippity hop to satisfy the need for jumping. Now, you'll create the child's daily visual schedule where you will place the activities that the child needs to complete throughout the day and ask them for their input on when and what sensory activity would they like to engage into in between those prescribed activity by you. Fourth and last, social stories. Through the use of social stories, you can teach your child when it is appropriate to use sensory behavior and when it is not. You also are teaching the child the appropriate way to redirect the sensory need. For example, if your child's sensory behavior is tapping with the finger on different objects, then you will create a social story in which you describe the unsafe aspect of tapping on dirty surfaces or hot surfaces. You will also describe what the child needs to use to satisfy this need. For example, a safe toy that he or she can have in their hands at all times and tap when needed. A person-centered approach based on understanding the individual's sensory needs and preference is crucial in managing sensory behaviors effectively. Please don't forget that every child with ASD is unique, and what works for one may not work for another. Be observative, analytic, and creative when it comes to a child's sensory needs. I hope this video helped you understand what sensory behaviors are and how to manage a child that engages in such behaviors. If you have any questions, make sure you type them in the comments below, and I will do my best to get back to you. Thank you for watching. I'll see you in the next video.